Hello students, thanks for watching my channel and subscribing the channel. Today we achieved an important milestone, that is 2 lakh subscribers. Now on the occasion of this 2 lakh subscriber, we'll revise this topic, that is fat soluble vitamins. We'll discuss these vitamins together, A, D, E and K. We'll discuss this vitamin with respect to their sources, their RDA, their biochemical functions, their deficiency manifestations. So we'll discuss this together, vitamin A, D, E and K. So the first thing is the forms, various forms of the vitamins, or in terms of vitamin A, it is also known as vitamins of vitamin A. Okay, so we'll discuss the various forms of the vitamin A, then D, vitamin E and vitamin K. So these are the 4 fat soluble vitamins. So the active forms or vitamins of vitamin A, it mainly includes retinol, which is a aldehyde form, retinol, retinoic acid and provitamin, that is beta carotene. These are the vitamins of vitamin A. They are having the vitamin A like properties. That's why they are known as vitamins of vitamin A, or different forms of the vitamin A. Now vitamin D, the active form is 1,25 dihydroxy cholecalciferol. This is the active form of vitamin D. It is also known as vitamin D3. 1,25 dihydroxy cholecalciferol. It is also known as calcitriol. Now vitamin E, it is present in the form of tocopherol and tocopheranol. There are, out of the 8 naturally occurring tocopherol, alpha tocopherol is the most active form of vitamin E. Vitamin K, the important form is, it includes 3, that is K1, K2 and K3. This K1, it is present in vegetable sources. It is known as phylloquinone. These are the naphthoquinone derivatives with isoprenoid chains. So K2, it is menaquinone, and K3, it is synthetic form menadione. Synthetic water soluble form, it is menadione. So these are the different forms of A, D, E and K. Now coming to the important sources of these vitamins. So second important point is sources. So vitamin A, the important source is cod or shark liver oil. So it is cod liver oil or shark liver oil. Then non-vegetarian sources, it includes milk, meat, eggs, etc. And beta carotene, it is present, this is provitamin, it is present in plant sources, mainly it includes carrots, then spinach and yellow to orange colored fruits, mainly mango, papaya, these contain vitamin A, beta carotene form, in the beta carotene form. So these are the important sources of vitamin A. Vitamin D, it is endogenously synthesized in our body in the epidermis, in the stratum corneum layer of epidermis by the UVB rays. So it is mainly from the sunlight. It is produced endogenously in our body by UVB rays. Okay, and the other sources are, it is mainly present in food of animal origin. Okay, only it is present in mainly seafoods. Okay, so it is present in fish, meat, etc. So important source is sunlight. Sunlight causes the conversion of 7-dehydrocholesterol into this active form. Okay, then the vitamin E, the important sources of vitamin E includes vegetable oils. Vegetable oils, mainly safflower oil, sunflower oil, soybean oil. These are the important sources for vitamin E. Vitamin K, that is K1, it is present in vegetables, green leafy vegetable. Spinach is the important source. Then menaquinone, it is present in food of animal origin. So non-vegetarian diet. Non-vegetarian sources, meat, milk, eggs, fish, etc. Okay, so menadione, it is synthetic form. Menaquinone, it is present in non-vegetarian sources. Got it? So these are the sources of these different vitamins. Now coming to the RDA, recommended daily allowance. RDA, vitamin A, the RDA in terms of retinol equivalent, which is one retinol equivalent is equal to 1 microgram. Okay, so it is 800 for females, retinol equivalent or microgram, and up to 1900 to 1000 retinol equivalent in males. So this is the requirement of vitamin A. While vitamin D in children and in adult, so in children requirement is 400 international unit, while in adult it is 200 international unit. Then vitamin E, it is near about 10 milligram per day in males, while in females it is 8 milligram per day. And vitamin K, it is 70 to 140 microgram per day. It is 70 to 140 microgram per day. So these are the RDA of these vitamin A, D, E and K. Vitamin A, the beta carotene form, provitamin, it is present in vegetables. The animal food of animal origin, mainly the cod and shark liver oil, it contains the vitamin A. Retinol, it is the important one. The beta carotene, it gives 2 molecule of retinol by the dioxygenase, and it is then converted into retinol. So retinol, it is stored in the liver. Retinol, it is esterified in the intestinal cell, incorporated into a chylomicron, enters the liver and stored in the liver as retinol palmitate and released as and when required. And in blood, it is carried with the proteins. Okay, this is retinol binding protein, it carried with the retinol binding protein. Vitamin D, it is important form is calcitriol. By the 7-dehydrocholesterol, it is converted into cholecalciferol in the skin. Then in the liver, with the action of 25 hydroxylase, it is converted into 25 hydroxycholecalciferol, and in the kidney it is converted into 125 dihydroxycholecalciferol, that is calcitriol, and it is important and active form of vitamin D. While alpha tocopherol is the most active form of the vitamin E, and this K1 and K2, phylloquinone, menaquinone, these are the naturally occurring vitamin. It is present in vegetable sources, while this one is present in food of animal origin. So this is about the form, sources and RDA of these vitamins. Now coming to the biochemical functions and the deficiency manifestations. Now coming to a discussion of biochemical functions. This vitamin A, retinol, it is important. It is mainly, it is having number of functions in our body. The retinal form, that is 11-cis retinal, it is present in the rhodopsin. So it is important in the vision. It is important in the vision, mainly in the Wald's visual cycle. Wald's visual cycle. So rhodopsin, it contains It is present in rhodopsin. It contains 11-cis retinal and opsin. It contains 11-cis retinal and opsin. So it is important for the dim vision. It is important for the dim light vision. Rhodopsin, they are important in dim light visions. Okay. Then they are present in the rods, and cones, they are responsible for the bright light vision and color vision. So it is important in the vision, that is 11-cis retinal protein. Okay. Now it is important in the Wald's visual cycle. This is important function of the vitamin A. Second, it is important in the growth and differentiation. Growth and differentiation of the cell. So retinoic acid, it particularly acts on the intranuclear receptors, and it is important for the transcription and translation process. So it binds with the particular elements in the DNA and important in the growth and differentiation of the cell. Then third, it is important in maintenance of germinal epithelium. Maintenance of germinal epithelium. Then important function is antioxidant. Antioxidant. So they are particularly important in prevention of coronary artery diseases. They are particularly important in prevention of cataract. Then fifth important function is, it is important in the skin. It is important in maintenance of epithelium. Okay. So it prevents the hyperkeratinization of the skin. It prevents the acanthosis and hyperkeratinization of the skin. So it is important in the maintaining the epithelium. So these are the various important function. Also it is important in synthesis of glycoprotein. So it is important in mucus formation, and it is also important in synthesis of cholesterol. So these are the important functions of the vitamin A. Okay, main is the vision, Wald's visual cycle. Okay, then vitamin D, it is important in the bone formation. This is the important function, bone formation of vitamin D. It particularly act on the three target tissues. The first one is the intestine. Second is the renal tubules, distal renal tubules. And third one is the bone. So it is important in maintaining the calcium and phosphorus level in our body. So it is important for the mineralization of bone. It is important for the osteoblastic activity of the bone. So it is important hormone. It is vitamin D. It acts as a hormone. It has target tissues, and it is important in bone formation, deposition of calcium and phosphorus in the bone. So it is important in the bone formation. This is the important function. Through intestine, it increases the absorption of calcium. By producing the calbindin protein, it increases the absorption of the calcium from the intestine. Then renal tubule, it increases the renal tubular absorption. So it increases the calcium level. It is responsible for deposition of calcium in the bone. So it is important in the formation of bone. So this is the important function of vitamin D, calcitriol. Vitamin E, the important function of vitamin E is the antioxidant. It is antioxidant. It prevents the lipid peroxidation. Lipid peroxidation. This is important function of vitamin E. It is a chain breaking antioxidant, prevents the lipid peroxidation. So it prevents the damage to various micromolecules. It acts synergistically with the selenium in the antioxidant function. So it maintains the RBC integrity. It is important in maintaining the RBC integrity. So this is the important function. Again, it prevents the formation of oxidized LDL. So it is important in the prevention of coronary artery disease. Also, it is important in the prevention of cataract. So this is the function of vitamin E. Now vitamin K, it is important in coagulation. It is important in activation of clotting factor, that is 2, 7, 9 and 10. It activates the clotting factor and converts the glutamate in this clotting factor into gamma carboxy glutamate, which is a post translational modification. So it is important in gamma carboxylation of clotting factor. So by the gamma carboxylation, it reacts with the calcium, it reacts with the phospholipid and converts prothrombin into thrombin. So it is important in the coagulation process. Vitamin K. So these are the biochemical functions of vitamin A, D, E and K. Now coming to the deficiency manifestations. Deficiency manifestation, the important one, vitamin A deficiency manifestation, the first symptom is night blindness. So it is night blindness, increase in the dark adaptation time and night blindness. This is the first symptom of vitamin A deficiency. Okay, then conjunctival xerosis, Bitot spots, spot. These are the triangular white plaques on the conjunctiva. Triangular white plaques on the conjunctiva, Bitot spots. Then corneal xerosis followed by corneal ulceration. And blindness, this is the preventable blindness. Okay, this is the most common cause of preventable blindness, vitamin A deficiency. So this is important for blindness. So these are the deficiency manifestations of vitamin A. Also it causes the hyperkeratosis on the skin. Vitamin A deficiency causes hyperkeratosis on the skin. So this is important manifestations of vitamin A deficiency. Now vitamin D deficiency, it will leads to the rickets in the children and osteomalacia in the adult. Rickets in children and osteomalacia in the adult. Now what are the different features, clinical features of the ricket? So before the 1 year of the age, the symptoms are like craniotabes. What is the meaning of craniotabes? It means the ping pong ball like appearance of the skull. It when you press the skull, it is like the ball. It will press and then when you release, it will release. So it is like a ping pong like appearance of the skull. So this is known as craniotabes. Then delayed or widening or open fontanelles. Then frontal bossing, prominent forehead will be there. Then when child crawls, so it leads to the widening of the wrist. Then when it starts walking, due to weight bearing, the weight bearing bone becomes bowed. So bowing of the leg, bow legs. So these are the important features of the rickets. Also there is Harrison-Sulcus and the rachitic rosary. Rachitic rosary means prominent and wide costochondral junction. So that is known as rosary. Rachitic rosary. And Harrison-Sulcus is there. That is along the insertion of the diaphragm, there is transverse groove. That is known as Harrison-Sulcus. So these are the features of the rickets in the children. So rachitic rosary and the Harrison-Sulcus. Transverse groove along the insertion of diaphragm due to spongy ribs. Okay. So osteomalacia, it will lead to the fracture bones, easy fractures of the bone, osteoporosis in adult, frequent fractures of the bone and osteoporosis. It is known as osteomalacia. So these are the deficiency manifestations of the vitamin D. Vitamin as such, vitamin E deficiency is very rare, but it can cause sterility. Okay, vitamin E deficiency, it can cause sterility and neurological manifestations. Sterility, as it is important in maintenance of germinal epithelium, the deficiency causes the sterility and also neurological manifestations. Neurological symptoms, mainly spinocerebellar ataxia. It is known as spinocerebellar ataxia. Also, it causes neuropathy, nephropathy, and retinopathy. Vitamin A deficiency. Then deficiency of vitamin K will cause hemorrhage. It will cause vitamin K deficiency. It will cause hemorrhage. So hemorrhagic manifestations will be there: red spots on the skin, reds and ecchymotic patches on the skin. So it will cause the hemorrhage. Hemorrhagic spots are red spots over the skin. Okay, because of deficiency of vitamin K. And for prophylactic purpose, menadione is given intramuscularly. Red spot are hemorrhagic tendencies, hemorrhagic manifestations. Okay, in the vitamin K deficiency. K for coagulation. Coagulation start with the K in the German. Okay, K for coagulation. It is coagulation. It causes the gamma carboxylation of clotting factor. Deficiency will delay the prothrombin time. The prothrombin time will be raised in vitamin K deficiency, and red and hemorrhagic spots will be there all over the body. Okay, so these are the vitamin deficiency manifestations of vitamin K. So this is in short discussion of vitamin A, D, E and K. Got it? Thank you very much. Keep watching. Thank you.